If you look at the US healthcare system today, it's not healthcare, it's sick care. We wait till the car engine has broken down.
Hey, Invisible Capital listeners, we're back with a brand new season. And this time, we're focusing on emerging technologies. More specifically, how those technologies are being leveraged during the ongoing COVID-19 pandemic. I'm your host, Lee Gibbs. As someone whose job it is to stay up to date on industry trends, I work closely with PitchBook research analysts and industry professionals to understand drivers across private and public capital markets. For the next few episodes, we'll be spending time in the health and wellness technology space, talking with founders, investors, and experts to better understand how segments within this market are evolving and changing how we think about the use of technology. To help us maintain perspective over the next few episodes, we're joined by our resident health and wellness analyst, Kaia Colban, who's written extensively on this emerging technology space across both enterprise and retail markets. Kaia, let's start at the top. Can you define what we're referring to as health and wellness technology?
I would say the health and wellness industry encompasses all different types of technology that help promote physical and mental well-being. A lot of this looks at the preventative side of it.
So if you think about industries such as dietary supplements, workout and meditation apps, all the way to telehealth, I mean, the list goes on, but together, these markets make up an industry that is massively profitable. According to PitchBook, the enterprise health and wellness tech industry is valued at $640 billion as of the first half of 2020. And it's only growing.
As a result of COVID, we've seen many segments within the health and wellness technology market experience an uptick in demand. For starters, smart fitness devices.
Some of the obvious reasons for that demand uptick include pandemic-related gym closures and social distancing measures that prevent people from being able to exercise in crowded areas or take in-person fitness classes. And within that realm, Kaia's research also points to growing demand for fitness devices that provide a more personalized experience for the user.
So one of the big segments within the health and wellness industry is biometric wearable and device technology. Biometric wearable would include any device that measures a biometric output. Key biometric outputs include heart rate, blood pressure, whereas if it's not a biometric wearable, it could be something like an odometer, something that's just tracking how many steps you take, but nothing related to what's physically going on inside of you would be a wearable, but not a biometric wearable.
You noted in some of your recent research that biometric wearable and device tech is expected to grow at a CAGR of about 16.8%, which would lead up to a $71 billion market by 2024. Can you just lay that out for us? Why is this corner of the wellness ecosystem set to grow so rapidly?
I would say new technological innovations have made these devices not only cheaper, but also creatable. Previously, our heart rate monitor was too large to fit in a watch. Previously, blood pressure monitors, it was a huge cuff that you wore around your arm. And now companies are able to integrate those into headphones. It's just something that was not possible 10 years ago. So it's not only that it's cheaper, it's that things are getting smaller and the hardware is getting better.
So there's a lot of innovation that seems to be driving the expansion of this industry. And speaking of expansion, one wearables business seeing an uptick in their user base is Oura Health. Oura makes a smart ring device designed to help users harness their health and body's potential through a focus on improving sleep.
We feel like sleep is the foundation and the start of your health.
That was Harpreet Singh Rai.
I'm the CEO of Oura Health. I studied electrical engineering in college. I messed around with computers and electronic devices. After college, going to work at Morgan Stanley in their M&A group. And then after a year, of gaining 50 pounds, about a pound a week. And I'm a small guy. I'm 5'5", and I was probably 150 pounds going into that. Started to realize how important sleep in my health was.
The Oura Ring takes a holistic approach to health tracking. The ring collects data over a certain period of time and aggregates it into a personalized dashboard via the Oura app, providing users with something they call a readiness score, which Harpreet says combines 4 different metrics.
We take a look at your long-term or 2-week average of sleep. We then look at your 2-week average of activity, and we sort of determine if you're imbalanced between your sleep and your activity. And then we look at, I would say, a third thing, which I call, physiological signals, right, or biometrics. And those happen to be heart rate variability, temperature changes, and respiratory rate. And it's those 4 things that we've heard from our users, and they've seen it in their readiness scores, that starts to change when they're sick.
According to PitchBook, Oura completed a $28 million Series B in March of 2020, making it the largest venture deal for a biometric wearable company in the first quarter of 2020.
The device really allows users to gain a daily insight into their health. Their wellness ring tracks many different biometric signals that a lot of current biometric devices are not tracking. For example, Oura tracks sleep quality, your sleep stages, your ECG level resting heart rate, your body temperature, and its variability. And all this data is recorded and then visible through their application. That is also a common trend we are seeing, where biometric monitoring devices are launching an application which enables consumers to better understand their health and what's being recorded. With Oura in specifically, I think it's their focus on sleep that really sets them apart. There are a lot of companies tracking your sleep and a lot of companies tracking your fitness, but not many that kind of look at the holistic approach and bring it all together.
It's exactly that holistic approach that seems to be resonating with consumers and investors alike.
We had 3 investors co-lead it: Forerunner, Gradient, and Square. We're a hardware company, we're a data company, and we're a consumer company. And so for us, it was the perfect set of partners. It had nothing to do with the pandemic. I would say that all of them were really aware of our ability to sense temperature and potential future applications of temperature, and that other wrist-based wearables don't have that. And so I think that was definitely something that was meaningful to the investors.
So Kaia, Harpreet mentioned involvement from Forerunner Ventures, Gradient Ventures, even Square. Fairly big names in the venture ecosystem. From your perspective, does an investment like this fit into their wheelhouse, or does this give an indication of investors expanding into wellness and health tech for the first time?
This goes along with their typical wheelhouse investments. Nothing of it is too shocking, but it does show how tech firms are now investing in biometric wearables. Square, they're a financial company. They do payments. People wouldn't think they're investing in health, but we see that all over the place where large tech firms are now diving into the health and wellness space. One of the first large highlights of this occurring happened back in 2019 when Google acquired Fitbit. We also see that VCs that are investing in health and wellness tech may not have traditionally invested in health tech per se. Previously, health tech was more med tech and biopharmaceuticals, which requires deep industry knowledge of biology and medicine and the healthcare itself. Whereas as healthcare companies are now tech-based, we see VC firms that are typically investing in platforms and applications investing in healthcare because healthcare now overlaps with those segments.
So the landscape is becoming primed for tech and healthcare to converge. As medical professionals and tech companies look for ways to slow the spread of COVID-19. Now, to continue using the Oura Ring as an example, sensor technology in the ring may offer a solution to detecting early warning signs for someone who is infected, but only showing minor symptoms.
People actually have micro changes in temperatures a couple days before they're sick, up to a couple days. Your body starts to fight before you know it and feel it. There was a user in Finland, actually, he publicly posted that I typically have readiness scores in the 80s and 90s, and I've had this ring for over a year, and all of a sudden my readiness score was at 54, and it said my body temperature was elevated a degree. And, he went and checked his temperature. He didn't actually see a huge change, but then he put two and two together and realized, okay, my data's off, and I guess I was traveling the week before. This was early March, really when things weren't even in lockdown yet, and he was in Europe. And so he then was like, you know what, I should call the health authorities and get a test. And he turned out positive. He described himself as no symptoms, was asymptomatic.
Oura is currently sponsoring a study with the University of California, San Francisco to determine if physiological data collected by the ring can be used in combination with other metrics to predict illness symptoms. According to Oura's website, the study aims to build an algorithm to help UCSF identify patterns of onset, progression, and recovery for COVID-19. And Harpreet tells us that Oura is also engaged in a similar study with the University of West Virginia.
They knew the potential of our device and how it could be helpful. And that's really how all the research studies got started. We actually donated over 2,000 Oura rings to frontline healthcare workers to start the study. When you're back at work as a frontline healthcare worker or any type of first responder, everyone's going back to work in this awkward environment, right? This harsh environment. And people want to know and make sure that they're doing okay. And the ones that with biggest risk are our frontline healthcare workers. With a little bit of data, people start to have a little bit more insights. That reassurance, really gives them confidence in how they feel.
The study started with a group of frontline healthcare workers, then expanded to Oura's user base.
So anyone can enroll in the UCSF study that has an Oura ring. We've had over 50,000 people from the Oura community actually contribute and be willing to share their data with UCSF. Right now, the biggest issue isn't the disease itself, it's the transmission and the spread of the disease. And if people had a little bit of an early warning signal, right? It's like a storm during the weather. Okay, I know a storm is about to be coming, right? I better go take shelter. In this case, it's like, hey, I think a storm may be coming. Let me go talk to the professional and see if it's here, right? And get a test.
So there's a lot of potential for how the application of this technology could become invaluable in the strategy to slow the spread of COVID-19. But to zoom out a bit, we're also beginning to see the opportunities for the application of this technology aside from the pandemic. So Kaia, what are additional ways we might see technology provide personalized solutions to healthcare?
There's two areas within personal health services that are really growing. The first is remote patient monitoring devices. Right now, we kind of have a separation between consumer-focused wearable devices and prescribed wearable devices, which are remote patient monitoring devices. These first started growing among the elderly as people wanted to ensure their health and safety. But now these consumer health devices are getting so strong that they are providing information and data that can be used by doctors, not just by individuals to try to increase their personal health. So not only do we see these areas merging, but we also foresee biometric wearable devices trying to partner more with physician offices in order to get prescribed, get FDA approval so that they are covered by insurance, and then also figure out ways to integrate with their doctor's technology in order to send that data back and forth in a productive, low-cost manner. And then the second area is we expect to see more investment in personalized health services as genetic tests become more viable and are providing further insights. For example, 23andMe, they're not just telling you where you came from and what your ancestry is. They're able to give you information such as how likely you are to be lactose intolerant.
And with any opportunity comes challenges. So Harpreet, when you think about the expansion of wearables technologies, what are some of the bigger obstacles that could hold back the segment from growing?
The first one I still will say is trust, credibility, and accuracy. This industry did start out with really, I would say more not health features, but gimmicks. 10,000 steps, it definitely can be helpful and healthy, but we've gone from sort of this Wearables 1.0 of activity trackers and step trackers into Wearables 2.0 movement where, hey, the focus really what consumers want to know is how to improve my health. And I think in order to gain consumer trust and credibility, you need to do a lot of independent research. And I think that's a challenge. And the reason I think it's a challenge is how do you actually get that research done and funded? In order to get an NIH grant today, it's years. By the time you get an NIH grant for a new technology, that technology is obsolete. And so I think that's one of the bigger challenges too when jumping into some of this research and credibility.
Harpreet also points to another big area of concern being
how data moves forward, between consumer devices and eventually, medical atmospheres has yet to be figured out. I don't think there's any clear model yet that works. We've done everything we can from the company side to make sure that this data lives with the user, retains with the user. What we have found is that understanding how this data could be used for good and potentially, unfortunately, misused and used for a negative intent or negative consequences. If you look at the potential and then think about how you can design a system so people can't abuse it.
The debate around data and privacy is one that I think most technology companies continue to grapple with. Kaia, I'm curious from your standpoint, what are some of the biggest hurdles to overcome on the privacy front, specifically as it relates to wearables and biometric devices?
I think the data and privacy concerns is one of the main limiting factors of the industry. Consumers are scared of how the data is going to be used. When you look at corporate wellness programs, they're scared they're going to be fired if they're in bad shape. People are scared that if their health insurance finds out that they're out of shape or that they are having respiratory issues or anything else, so they might deny coverage or use it as a pre-existing condition. I think it's really important for players in this space to gain the trust of the consumers and show that the data cannot be used against them. And that is just going to be a huge hurdle to overcome. I think something that might help drive the industry is the creation of new legislation that speaks exactly to how employers or insurers or even your doctor can use this data to their advantage. And this may help increase the security and mitigate consumer concerns. And then consumers are also scared about like the big tech firms such as Google or Microsoft getting their data as well. Google now owns Fitbit. And if Google was to now know my workout routines and my health, they could then sell that to a health insurer. So even if it goes through a third party, it could be risky.
So obstacles aside, let's talk about the practical applications of this technology moving forward.
If you look at the US healthcare system today, it's not healthcare, it's sick care. We wait till the car engine has broken down. Really, if you look at wellness tech and wearables and how it's starting to meet the healthcare industry, that's like what's happening. Perhaps we can give information that's helpful to users so they can at least get a heads up that maybe I should go get checked out by a medical professional. So I really do think the future of health is more and more technology working together. That's also what makes it really hard, is because these disparate companies have to figure out all how to work together.
Kaia, I guess I'm just curious, would you agree with that outlook from Harpreet, and what would need to happen in order for more companies to be able to work together?
I agree that the future of health tech is really about having companies work together in an integrated stack versus disparate companies collecting and individually managing data. Because one company cannot analyze everything for the consumer and then also provide the proper infrastructure for hospitals. And all these different systems need to be able to communicate effectively. Not only is it very expensive for physicians and hospitals to set up multiple systems, but it's very cumbersome to manage all the different systems. Furthermore, when you have multiple systems, data incongruencies occur, and we want to be eliminating incongruencies. We also want to minimize data recollection activities that mitigates the number of servers you need and potential errors and ensure all the information is accurate. So I think having systems that integrate is very, very important. It also makes it easier for the consumer when they have an ecosystem that all fits. If you were to think of how Apple is easy for a consumer because Apple Watch fits in with their computer, with their phone, where they can see the data across multiple different platforms.
Of course, none of this happens without considerable investment into the fast-growing space. But Harpreet, for one, is optimistic.
We've definitely seen a lot more interest from potential investors, partners. It's interesting. You see a very different set of people you talk to about raising capital from that are in the healthcare industry than the consumer industry. And I think it makes it tricky to navigate for companies like ourselves and startups who are trying to figure out what direction to go. But even for venture capital, these worlds are colliding more and more. And so I think even there, people don't want to miss opportunities. And I think a lot of them are thinking through that really, really smartly too.
So from Harpreet's perspective, we can perhaps expect to see more VC activity from investors who traditionally haven't been interested in health and wellness tech, or even the general wellness space. Kaia, do you have a similar feeling that we'll likely see more involvement from non-traditional investors and venture firms who haven't before been specialized in healthcare?
VCs that previously thought of healthcare were thinking of medtech and biopharma. But as that definition expands to include all these health tech companies, I think more VCs will be investing in the health and wellness space. For example, we see VCs focus on platforms and mobile apps and consumer product goods now taking interest in the health and wellness space, especially as the space becomes much more consumer focused and not just in-hospital focused.
COVID-19 has thrown every industry into unknown territory, and today's conversation has proven that the biometric wearable and device space is no different. The advancements we've seen in this short amount of time are evidence that this technology may be a bigger part of life after the pandemic. However, early success would tell us that no one solution can exist in a vacuum, meaning a healthcare tech stack may be in the future for all of us. But in the context of this pandemic, what happens when people contract COVID-19? Contact tracing has been key to many countries' pandemic response, but the US has been slow to adopt the technologies and processes required to be effective. In our next episode, we'll learn about digital contact tracing and some of the challenges around the technology. A big thank you to our guests, Harpreet Singh Rai and Kaia Colban.
Invisible Capital is a production of PitchBook. Executive produced by Kaia and Adley Bowden, hosted by Lee Gibbs. This episode was produced and edited by Jen Germain. Audio mix and additional production support by Kaia and Allison Sharoni. Cover art by Landon Early. Subscribe to Invisible Capital on Spotify, Apple Podcasts, Stitcher, or wherever you get your podcasts. For more information, visit pitchbook.com/podcast.